Good evening, everyone. Hope everyone is having a pleasant day and great to see you all today evening. This is a webinar on hospital administration rules for public health graduates by Dr. Prashant Rajendran. One Public Health is actually a portal which is simplifying public health for everyone. I'm Dr. Sudarshan, and I'm a designated partner for One Public Health. To know more about One Public Health, you can go to onepublichealth.com. And I would like to welcome my friend Dr. Sabha Rathinam, who is an SMO with WHO, to introduce our guest today.
Good evening, everyone. Thank you all for joining us today. Even though it's being a Saturday evening, so many of you showed up. That's great. And it gives me great pleasure to introduce our speaker for today's session, Dr. Prashant Rajendran. Dr. Prashant is an MBBS graduate with an MD in community medicine, and he is the founder and medical director of IRED Hospitals, and also serves as the director of IRED School of Health Sciences, which is based in Chennai. So he has over 10 years of experience in healthcare and diagnostic sector. He has also played a key role in building and strengthening hospital services, developing diagnostic infrastructure, and creating structured clinical training programs. His work reflects a strong integration of quality patient care, preventive health principles, and systems thinking within a hospital setting. On a personal note, this introduction is especially meaningful for me because Dr. Prashant and I were schoolmates, and we've been knowing each other for the past 15 years. So that is something special. And it's truly inspiring to see someone you've known for years grow into healthcare leader, shaping institutions and mentoring future public health professionals like us. We are glad to have him with us today to share his insight and experiences. So, in today's session, we'll be discussing about how public health training can translate into hospital leadership, what skills truly matter in hospital administration, whether additional qualifications is necessary in case of if we get into administrative roles in hospital setup, and the realities and challenges of this path, and how to position yourself if this is the direction you're considering. And that's the brief introduction about him. And over to you, Dr. Prashant. Thank you.
Hello. Good evening, all. I'm very thankful for you to attend this session on a Saturday evening. And Sabha and I, like he said, we are known to each other from our school days. So it's very nice that he is part of a greater initiative. And I take a lot of pride, and I'm very proud that Sabha is into WHO, and he's heading state SMO, and he's into bigger roles, because what we spoke over on our terrace meetings has become a reality today. So before we jump into our topic, I just wanted to introduce myself. I am Dr. Prashant. I've done my MBBS and MD in community medicine from Savitha Medical College, Savitha University in Chennai. And I did my UG in 2010, and followed by which I joined my PG. I was a pre-NEET batch. So 2016, I joined my PG, and 2019, I completed post-graduation. In the 9 years in Savitha Medical College, private university, I have done whatever was possible in the form of learning, and that is what has shaped me to be able to run hospitals, institutions, and talk to people, negotiate deals, and that has been the foundation for the place I've achieved today. And in those 9 years, it has been a very fruitful experience. I have never said no to anything. Whatever opportunities, whatever work, whatever, be it small, big, large, whatever the size it was, I have always taken it as a challenge, and kept doing it. Right from probably drafting a MOU to writing a proposal for the university, and all those things have somehow shaped me when because it was all done without any financial obligations. So it has shaped me to. So whatever I do today is already it has been done at the past. So that is a brief about my education. And subsequent into 2019, we took over a small hospital in Chennai, and it was a small 15 bedded hospital. And we started working on it. And I always wanted to. My journey into community medicine, MD community medicine, was very simple. I wanted to do MPH, Masters in Public Health, and in US. That time in India, there are very less schools offering, colleges offering Masters in Public. So I had given my GRE, I had given my TOEFL exams, and right time I got a call from my university that there was one seat vacant and I can apply for it. So I just wanted to break all norms, just went and signed the application, took the seat, and then there was no looking back. So to look at MD community medicine as a degree, I view it differently because there is a myth that MD community medicine is a paraclinical or a non-clinical subject, and you cannot technically practice or you cannot be involved in active clinical aspect of it, of any hospital or anywhere for that matter. It is the way you view it because I see it differently, and I have always positioned or sold. So I always sell myself in a way that it is acceptable for all. So you take the skills from MD community medicine, use the degree, and then there's no looking back. And subsequent to that, like I said, we took over a small hospital in Anna Nagar, Chennai, and from there within 6 months we outgrew the capacity. Then we moved to a bigger building. Then we established what the present hospital is, iRight Hospital, which is a 50-bedded multi-specialty. From day one, we were giving training to a lot of interns and girls who are from down south, very backward backgrounds. They used to get enrolled in some university with a diploma degree where some small teaching happens in their state, but they came to us in 10, 15 numbers, and they used to stay with us for almost 1 year. So we used to provide the food accommodation, we used to train them, and we used to plan their training in such a way that they are exposed to all departments of the hospital, right from your reception to nursing care to your OT, so that I wanted them to be fully tuned to how a hospital functions. Then we are doing multiple batches of them, and then subsequently we wanted to formalize it into a degree program. That is when we have collaborated with one private university in Chennai and started the iRight School of Health Sciences, where we offer all BSc programs. Now this year we are planning to offer post-graduation programs, MSc and MBA Hospital Management. And this has been the journey so far. It's been good and always fulfilling, challenging at the same time. So this is my background, and I will just try to to throw some light on where we can join or where is the common point of contact between public health graduates and their role in hospital administration. There are a lot of similarities. All public health graduates look at it as they feel hospital is it's a part of the public health system. So it is not anything different or anything away. So I think I'll just try to throw some light. Let us see how you're able to understand. So the basic thing is to understand what are the hospital administration roles, identify career pathways for public health graduates, and learn the required skills. We'll see the real world applications, how it happens. So hospital administration, like I said, it is in public health, private hospitals or public hospitals form a subunit of the entire healthcare system. So hospital administration is basically planning and managing hospital services, coordinating with various clinical, non-clinical departments, ensuring efficiency, quality, and patient safety. See, efficiency is because, of course, your hospitals are being funded with a lot of money, and the management will always want the resources to be utilized in the most efficient manner. And quality and patient safety have become the utmost priority for any hospital administrator, because the quality of your care and the safety of your patients are always your priority. So hospitals as public health systems, what role they play is they play a role in disease surveillance centers, infection prevention hubs, for public health program implementation, population health management. So how are public health graduates essential in hospitals? So the expertise we bring in is we know about epidemiology, and we are always data driven. So that is our core, and that is our strength, and that is what we play with. And we are more for prevention focused approach. Before any issue, we try to set a process, set a system to prevent the problem to escalate. And you will find a drastic difference between our approach and any other clinical person heading the hospital. So we always think it as a process and system-based approach. So this capability is because of what we have learned in our graduation. This is basically to try to understand the structure in which the hospital functions. There is going to be our operation manager, below which your staffs are going to be there. Then there's a quality manager. There's going to be an administrator, above which a medical director, and then a board of directors. So that is how the hierarchical system functions, similar to what happens in a public health setup. See, quality is something, like I said, quality and patient safety are important aspects in a private or a public hospital. And so this is something which is evolving, and many of you would have heard about it, read about it in your graduation. Your accreditation process, which is your NABH, JCI accreditations. What happens is, when these processes are set, when this the milestone is achieved for an institution, there are certain things which are unorganized becomes organized over a period of time during this process. So during this NABH entire 1 year or 6 months, the entire system in the hospital is going to be revamped, and they are going to fall in line, because NABH doesn't allow you to go in whichever way they want. So, and it is a set protocol across institutions. And quality management also includes your clinical audits, quality indicator monitoring, continuous quality improvement. This is some area which is a niche area where public health professionals can take up these roles in hospitals. So I'm just giving you a light about which areas you can, wear the mask, hide your public health, use your public health graduation, as well as become one among the hospital management or hospital industry. In infection control, where infection surveillance, prevention of hospital-acquired infections, outbreak investigations, antibiotic stewardships, hospital operations management. This is basically your patient flow, your marketing, your bed management, resource allocation, workflow optimization. See, what happens is, in a hospital, there is going to be a lot of gray areas, which you first identify those gray areas, what is not being organized. So, for example, in our setup, you have patients coming in from various sources. So these sources initially was not tracked. It can be walk-ins, it can be through a referral doctor, it can be through a private consultant, it can be through online engagement. So the flow of these patients are important because only then you can understand how your marketing strategy functions and how is your what is your demographics of your patients and which area they come from, so that you can plan your strategies accordingly. Bed management is something very important. Like I said, when we are running a small hospital, 15 bedded, I still remember we used to run out of beds because we used to have theater cases running as daycare procedures, where we used to be listed around 15 cases in a day, and we used to have exactly 15 beds. So even if one patient stays back overnight, for the next day I will not have beds to be given. So we had to redo the bed management, ensure that we split the cases into first half, second half, plan the OT, plan your staffs, so that there is no clash among consultants or anesthetists. So this is a very tricky area because you need to give quality care, ensure patient safety. At the same time, the resources have to be managed. You need to ensure that your optimization of beds, available beds are there. At the same time, turnaround should be lowest. The better the turnaround, the more the revenue. It's a very simple, financial aspect of it. So your turnaround is, the better the turnaround, the better your revenue is going to be. And of course, the management is going to expect that only. And resource allocation, like I said, your manpower, based on the flow and based on which duty the work is heavier, accordingly you can allocate your resources and workflow. So once you set this process and each one in your team understands how the flow of work should be there, it optimizes the entire operations of the hospital. This is one important area. Like I said, quality is one area. Second is your infection control. And third is your hospital operations management. Next is health information management. See, these for initial 3 areas, anybody, all hospitals, be it, say, even now 25 bedded to 150 or 1500 bedded, everywhere this quality management post and requirement is higher. Second is your infection control, but this is on a higher mid-level hospitals like 150 to 300 bedded hospitals. There is going to be requirement. Operations management, every hospital requires it, be it even your 10-bedded nursing home. Depending on that, they may size down on the requirement, but there is a need. Only then your optimization and resource allocation is better. Health information management for hospital data analysis, dashboard monitoring, performance tracking, regulatory reporting. See, regulatory reporting is one aspect. Having running these institutions, see, previously for a doctor to put a clinic, they used to say one table and one Ganesha photo is enough. So he can just sit and start his clinic, and no other requirement was left. So probably 25 years, 30 years before. Now, to set up a clinic, to set up a hospital, you have n number of regulatory licenses which are mandatory, which only helps you to improve the quality and patient safety. So you have right from your biomedical waste, pollution, your corporation municipal license, your CEA, your fire. See, all these things help you to maintain the safety and quality in the hospital. But it has become so enormous that you need a person only to take care of the regulatory reporting, because it is going to be, it has to be renewed once in a while, probably year, 3 years, 5 years, and it has to be monitored. You have certain documents which have to be submitted to those agencies, and these are not interconnected to each other. I think you'll be understanding it better. See, all of these departments function individually and each one has their own forms, there is no centralized system where, okay, I want to start a hospital, I just go there, put my details, I'll get all the licenses. It doesn't work like that. Each one functions differently. Each one is bounded by or abiding certain laws. Like for your ultrasound machine, there's a PCP and DPR. For your X-ray, CT, you have your AERB. There is a regulatory body and there is an act for it. So just to manage the licenses, it has become very taxing on the clinician. So most of the places, clinician-run hospitals are becoming, outdated, or it is becoming very difficult for them. So they eventually move to corporates. Either they give it up, or they shut the shop, or the next generation doesn't want to take it up. So a doctor previously who was able to run the institution with just a Ganesha photo and a table, eventually moved to a single small nursing home setup. And he used to have his residence on top, the nursing home below. Then he eventually made it into a bigger less than 25 bedded hospital. Then now it started becoming bigger. But as the growth has taken place, the regulatory bodies are also evolved over the period of time. That is why this area of health information management has become very important. Patient safety is these are another aspect where incident reporting, root cause analysis, risk prevention strategies, safety culture development. I think as public health professionals, we are tuned to all these things. These are areas which are already part of the hospital also. So, and like we are tuned from day one to prevent any incident. So our presence is going to be very helpful for the institution. A lot of public health programs which are being implemented in hospitals, and lot many programs are there. So this involves government coordination, trying to bring in consultants from the government, trying to get some supplies from the government to implement in your setup. That is one area where you can combine your resources. So these are the entry level roles which are available. For example, your quality executive, infection control executive, operations executive, public health coordinator, or your quality manager, and you have your hospital administrative roles. You may be given in charge of a block or OT, theater block, where you'll have to plan the schedules. So these are some of the roles which are more suitable for public health professionals. Mid-level roles, like I said, hospital administrator, quality manager, operations manager, HR, program manager. Senior leadership are COO, CEO, hospital director, healthcare consultant. See, these are the skills I believe all public health professionals are already utilizing and using it on everyday basis. Epidemiology and biostatistics are our bread and butter. Leadership and communication, problem-solving ability, healthcare data analysis. So these are the areas where we apply it in real world. See, how you can improve yourself as a public health professional to be well suited for a hospital job or a hospital environment is you do any certification program in accreditations, any quality related certification. It adds value to your CV and you become well suited to a hospital environment. Same way for infection. These quality infection, these things are already available, where if you just add that certificate and you're aware of it, you become more experienced and you are going to be immediately taken inside. Because you are already having a public health knowledge, and you, on top of that, you are going to enhance it by having some quality related certification, which are run by these quality councils, NABH, JCI, and routinely every month they conduct these programs online, offline. So you can just do the certification and enhance your quality. Hospital expansion planning, this requires actual experience working in a hospital so that you can understand how each department functions, how the ground staff functions, so that based on that you can plan the resources, how you can expand it, how you can plan the for that institution or any other institution for that matter. Operational efficiency improvement, how do you manage the resources, how to be lean, mean. See, in private sector, if it is a public hospital, it is totally a different ballgame. But in private hospitals, most of the private hospitals are going to be lean and mean. That is, you are going to have limited staffing, and you have to get maximum out of it. So that is this understanding comes only when you work in a hospital, and with the real world understanding, you will be able to implement operational efficiencies. Of course, these are the newer upcoming fields where digital health, AI in healthcare, telemedicine, how to administer telemedicine, and healthcare analytics, healthcare startups. These are the future opportunities available for public health professionals in hospitals. So, key take-home messages: public health graduates are vital to hospitals. They improve quality and safety. They lead healthcare systems. They shape the future of healthcare. So I just want to share a few of my experiences as a postgraduate. So as a postgraduate, I have traveled much to Jharkhand, Uttarakhand as a shadowing a WHO consultant. And I also had the opportunity to be a trainee under a Public Health Institute of Tamil Nadu, which is the Institute of Public Health in Poonamallee in Chennai. So there, when I was there, I had the opportunity to network with a lot of deputy directors, public health, government officials, and all those things. See, it gave me the foundation to understand how healthcare system works on a larger scale. And so with that knowledge, when we start implementing when I was implementing in my hospital, it gave me the confidence that I'm not doing anything wrong, because I've already seen how it is being run in a larger environment. And the same thing I'm trying to, one subunit of it is my hospital, and I'm just implementing it. So that is my session. If you have any questions, you can put it forward.
Yeah, Misbah, please moderate the Q&A session. Do any of the participants have any questions? Please to ask. You can either raise your hands, or you could just, uh, you know, jot down your questions on the chat.
So I think MPH graduates, do they need masters of? See, technically you don't need, but you should be able to convince your whoever is your employer to take up the role as a hospital administrator. Of course, you'll have to start from the scratch as a hospital admin or executive admin, and then work your way up. Talking about Masters in Hospital Administration, this year we are introducing that program as a 2-year degree, where it is mainly designed for healthcare professionals like nurses, technicians, and BSc graduates who are who have taken a break in their career, who have gone family way and they want to come back. So this bridges their gap and makes them better enhance their skills and position themselves as better healthcare providers. As freshers, can we get these positions, and starting from scratch, what's the current packages they offer? I'm not sure of the current package they offer. Yes, of course, as freshers, you can apply for these positions and check with these hospitals. But of course, as I said, they may take some time to understand your ability, but definitely it is a good option. Completed MHA, pursuing PhD in public health. Could you please guide me on the career prospects and growth? So career prospects with PhD, rightfully, today I had the opportunity to conduct, I was part of the interview panel for psychology and School of Health Sciences at the university. So we had a lot of aspirants of PhD and people who are in the process of submitting their thesis and stuff like that. So as a PhD graduate, a better environment for you would be working in an institution setup like a university where they have, where they already have a public health school, or they have plans of starting a public health school, where it will be useful for you, for your growth, as well as the institution's growth. Which short-term program certifications are helpful for getting these entry-level roles? Can you mention some that we can consider for this? Yeah, these for these entry-level program roles like as a quality manager or a quality executive, or to be part of the NABH team, there are a lot of certifications done by NABH themselves, and there is an organization called CAHO. I will share the details. Probably they can share it on your WhatsApp group where you can check your ability to attend those programs. It will be definitely helpful. It will give you an insight of how quality, what are the rules, what are the foundations for establishing these protocols. Outside India for hospital related roles, that depends on how you are able to, of course, convincing. See, this basically you have to convince the employer that you are well suited for the job. Definitely, as a public, once the HR sees your CV as a master's in public health, he is not going to relate that you are capable of handling anything, any job inside the hospital. So it is our duty to sell ourselves in a certain way where we have the interest and inclination to learn and merge well and well suited for the job. And of course, opportunities outside India are limitless, but you will have to check on for that. How can hospitals collaborate with the public to enhance preventive healthcare services? Like I said, a lot of government initiatives are there which can be availed, or for example, like in my university where I did my UG and PG, Savita Medical College, initially we had a certain count of deliveries which were happening in a month. So in Tamil Nadu, there is a scheme called Dr. Muthulakshmi Reddy scheme, which allows the government gives a cash incentive for pregnant mothers who do institutional birth. So it is also combined with the central government funding. So this Dr. Muthulakshmi Reddy scheme was only available in government institutions. But there is a government order which at that time stated that certain private institutions like a medical college can apply for this facility. What happened was, when we found out, we tracked the GO, we got the details, we wrote to the deputy director. Their simple request was, you should not charge the patient anything. Then if you are proceeding with it, we can give the approval. So what happened over the next 2 months, the delivery rates in our hospital just like that increased, because we were empaneled with this preventive healthcare service or the public health, publicly available government schemes. How to become a research analyst after completing a MPH? Do we need to do any other? We need to do any other course too. See, as a MPH graduate, you would already be used to or known about research methodology. I think that is enough. And as a MPH itself is a qualifying, is a good enough degree to become a research analyst. Of course, you should be aware of your SPSS and analysis softwares. So I don't think any other course is required. So yes, NPTEL Swayam certification is also a good certification for getting these jobs. You can check for research analyst job in your, your job portals, and you can apply for it. Yes, difference between PGDM and MBA. MBA is a full-time program, full-time, part-time, where it's a master's in business administration program for hospital administrators or, for example, hospital management, MBA in hospital management. It is UGC and AICTE recognized program. Whereas your PGDM is a postgraduate diploma in management with a specialization probably in hospital management or in any other specialization like most of the universities are offering. PGDM can be 1 year, can be 2 years in many cases. It is a short term, it is not a, there is a drastic difference because it's a postgraduate diploma, and MBA is a master's in business administration. So this is a drastic difference. But once you have, for example, if you are a MPH graduate, you don't need another MBA to sell yourself or to be, accepted in the hospital industry or any other industry. You can do a PGDM. But if you are not an MBA graduate and you are a graduate with some other field like BDS or BPT or anything like that, to do your masters, I would suggest you do an MBA so that you have a proper master's degree with you. And PGDM can be done as a secondary degree. What is the eligible criteria for being an assessor of NABH? For being an assessor of NABH, you need to have a certain amount of experience of say 10 years. You should have worked in a NABH accredited hospital for a certain period of time. That is the way forward if you are taking the path of being an assessor or a quality manager. I'm an MHA student. My question is, how can public health graduate without a clinical background successfully position themselves for leadership roles? Yes, as a public health graduate, see, public health graduation, like a master's in public health, is being taken by people from various industries. So, of course, in MPH or you do an MBA hospital management, you are going to have certain areas which, certain subjects which give you a background about how a hospital functions, or you can read upon that. Once you have that knowledge, you are going to be able to convince the hospital administration for the bottom level role. And based on that, you just upskill yourself over a period of time, keep doing some certification programs. And then over a period of time, your experience is going to add value. And over next 3 years, you will be more successful in the hospital industry. How can hospitals collaborate with the public to enhance prevention? For hospital administration role, medical graduation is not mandatory. See, unless you are going to be a medical director, where you need to be a doctor. Other hospital administration roles like your COO, CEO doesn't technically have to be a MBBS. It can be an MPH with some certification, and it can be with a PG diploma or an MBA. Various combinations can work, because now there is hospitals are growing across India, and there is going to be a need for all these professionals. Take, for example, a hospital of 5 floors, 6 floors. There requires a floor manager, there requires a OT manager, there should be a OP block secretary. And to organize all this, you need a manager, a combined deputy manager and a manager, or a quality manager with a deputy manager and a general manager. These roles, preferably, we have over a period of time, it was only for arts and science graduates, and now it has shifted to anyone with some inclination with understanding of either administration or with the hospital background. So we fall in the second category with the administrative background. We are going to be taken. Any other questions?
So I assume that these are the questions that you have, and thank you, Dr. Prashant, for answering all the questions patiently. So I like to call upon Ms. Bar to do the vote of thanks, please.
Good afternoon, everyone. On behalf of One Public Health, I sincerely thank Dr. Prashant Rajendran for delivering such an insightful and informative session. We are grateful for his valuable time and expertise. I also extend my heartfelt thanks to the organizing team and all participants for their support and active participation, which made this webinar a great success. Thank you, everyone.
Thank you all. We can keep in touch on LinkedIn or any other common platforms.
Yes.